This is a story about what happens when you have breast cancer, told in real time. I'm Eva, and my guest today, of course, always my co-host, Kristen, who's really the host now. I'm just the Oz behind the scenes. And our very special guest today is Alicia, who was Kristen's infusion nurse at one point at Scripps. And so she has a really interesting story that we wanted to bring to the audience because it's a little different from what we've been used to. And we felt like it was something that needed to be told. So welcome, Alicia.
Hi, thank you.
I'm going to spoiler alert here and say you're about to have a DIEP+flap surgery, and we absolutely want to hear about that.
Mm-hmm.
But that was not the beginning of the story. So can you kind of go back to the beginning and take us through, just everything that's happened since then?
Yeah, I can do that. My family history is kind of where it all started. It's all on my dad's side. My grandma when I was young, and both my aunts were both diagnosed with breast cancer in a short time from one another. And I was currently pregnant with my second son. So this was back in 2011. After I had my son, I did ask my nurse practitioner at my OB office at postpartum visit if I would be eligible for mammograms earlier given my family history. And
How old were you?
I was 30 at the time, like just turned 30 a couple months before that. So I was told most likely no, but the insurance may cover genetic testing. Fortunately, one of my aunts had genetic testing done and knew that she was positive for the BRCA2 mutation. So I got tested for that and found out early 2012, I think it was, that I had the BRCA mutation also. So that kind of prompted a couple different options. I could do surgeries prophylactically, or I could be in different screenings throughout the year, just kind of to see how things progressed, if at all. So I chose the latter to do the screenings. It was supposed to be a mammogram and an MRI alternating every 6 months. So that was the plan. At some point,
did you sort of like live by the clock during that time? Or did you get used to it?
I kind of got used to it. So I do have to say I wasn't very good about the mammograms because when I went, being younger, a lot of times the mammograms aren't useful because the tissue is too dense and so you can't see as much. So that's why the recommendation was to wait till you get older typically. So I would get questioned when I went there, why are you here? You're too young. And so it kind of made me feel like, well, if I'm not going to find anything on a mammogram, maybe the MRI is the better way to go. So I did my MRIs annually and I had my annual physical exams, but I only did one mammogram at that time. Everything came back clear all the time. In 2019, we did a big home remodel and we were just busy with a lot of stuff because a lot of things were going on. We were doing a ton of things. I went to my annual exam later in the year, got my authorization to do my screening for my MRI, but we went into 2020, and so I never ended up going in. So I was trying to be good about self-exams. In early 2021, I found something that was suspicious, immediately tried to make an appointment, and everything kind of went rolling from there. So March 22nd, 2021, I was diagnosed with breast cancer. That in turn prompted all the doctor's visits, meeting my team, everything. And it ended up being stage 2, HER2 negative, hormone positive, inductal invasive carcinoma.
Yeah, so we had the same. We had the same receptors and we had the same type.
Yes.
Okay.
So part of the reason why I decided to hold off on doing any prophylactic surgery was, one, I was having kids. I was in my early 30s. I had just had a second C-section. So another surgery was not really something I was wanting to do at that time. But I also decided to go back to school to become a nurse. So, it's really intense just going through nursing school, and then you have to find a job on top of it, and then you typically work night shifts. So it was just a lot of different variables that didn't make it an ideal time.
Before you found it is what you're saying.
Yeah.
Right? You're talking about that time between when you started getting monitored and you found the cancer.
Okay. Right. So that's where I thought the surveillance, the screenings was still a good way to go because everything was always coming back clear.
What made you want to go back to school to be a nurse?
I don't know. I went to school to be a PE teacher and then had kids and was happy doing what I was doing. And then I had this dream that I you know, the feeling you get when you have a paper due and it's just like that pressing feeling like, oh my gosh, I need to get this done. It was a dream that kind of was like that. And I woke up thinking, why am I dreaming about school? I'm not going to school. I'm done with school. And then I just decided I wasn't happy doing what I was doing anymore and had considered nursing. So decided, sure, I'll go back to school. With a 3 and a 5-year-old, it wasn't ideal.
Was there a specific specialty of nursing that you were interested in from the beginning?
In the beginning, I was interested in labor and delivery and postpartum, mostly labor and delivery, just given the fact that I was a new mom and I had a lot of interesting feelings about it. And so that was just what I wanted to go into. Kept an open mind through school. And it wasn't until I went through my diagnosis and treatment that I decided to go a different direction and go into oncology, which is how I landed at the infusion center.
Which is how we met.
Yeah, you just said to us that you were diagnosed in March of 2021. Mm-hmm. And I can look at the calendar and see that is over 2 years ago. And yes. I know just as the sort of naive question asker over here, mm-hmm. that Kristen's entire experience from beginning to end did not take more than 2 years.
No.
So will you take us inside the timeline a little further and explain what's been going on?
Definitely. So I started chemo in April, and I did, I think, the same treatment plan that Kristen did, the ACT. So that lasted for 16 weeks, and then had a period of time off. So I finished, I think it was September. I should know this. It's in my phone, but
August of 2021.
Something like that. Yes. And then I had my surgery in October. So I did a double mastectomy. That was always going to be the plan. That was never a question. And I feel fortunate because some people, it is a question, but knowing that I had the BRCA mutation, it was kind of an easy question to answer for me. So then the plan after that was to start radiation. But given it was mid-October, I didn't have the mobility to go to radiation right away. And we went into the holidays. So I didn't start radiation till January of 2022. And that was after getting some physical therapy to get my shoulders mobility back. And finished radiation in February 2023. Was told that I needed to wait at least 6 months to let everything heal before I could have my reconstruction. So 6 months after that, I was just kind of getting back into work. I'd only been back to work for a few months because I took a full year leave of absence. So part of me wanted to build up my PTO again and have the time to take off. Plus, I just needed to kind of get away from it for a little bit and heal. And I was hoping that the more time would go by, the better it would heal. But I think it's gotten worse.
Yeah.
So,
can you tell me what your original reconstruction plan was going to look like?
Yeah, originally, well, in the very beginning, I considered a DIEP+flap, but was told I didn't have enough tissue for that. And that wasn't really going to be on the table. So the option became a LAP+flap or implants. So I currently have expanders. They're under the muscle and it is very uncomfortable. So when we started talking about my reconstruction as it was going to be laid out, I was like, I want implants, but I would really like to have them over the muscle. I don't like them under the muscle anymore. So given the way my skin healed, that kind of went off the table. DIEP+flap came back to the table. And the other option was the LAP+flap. But I like to work out, and a LAP+flap to me doesn't sound functionally normal. So I was kind of pushing towards the DIEP+flap. I did have to get an angio CT to look at the abdominal tissue and the vasculature in there to see if I'd be a candidate to do a DIEP+flap. Fortunately, I was. And that's where we are as of right now. The plan is for the DIEP+flap.
And to talk a little bit about the LAP+flap, anybody who has been listening and listened to the things you need for surgery with Dana Donofree, that's what she had back 15, 14 years ago. And she had a revision just a little over a year ago now, where she had the implants taken from under the muscle and put over the muscle. And she said there was immediate relief of pain from that. And so what's a LAP+flap?
So the LAP+flap is where they take a piece of the muscle that's in your back, your latissimus dorsi, goes in your back, and they kind of wrap it around the front and it almost makes like a bra to hold an implant so that it's not under your chest muscle.
Got it.
It seems to me, just as an observer over 20 years of plastic surgery marketing, that technique is really not favored anymore. And it's almost rarely done.
I don't know. My aunt has one. Another girl I met has one. I think it depends on the situation. One of the girls that I had talked to had it done, but she was bigger chested before everything. So she really wanted to kind of be what her normal was. And I think that was the way to support that. My aunt did it on one side, but I don't really know anybody else offhand who has it.
And so can you tell me with radiation, how many sessions did you have? How many weeks did you have of radiation?
I did 6 total, 5 weeks of the normal radiation. And then the last week was what they called a boost, where they just tried to focus in on specific ares.
We had the same.
Yeah.
And you showed me your skin
Yes.
at my infusion about 2 weeks ago.
Mm-hmm.
And I couldn't believe that it still is dark.
Yeah.
As it is.
Yeah.
Did you have a lot of rawness?
Yes.
Okay.
Yeah.
Probably pretty similar to what I had.
I mean, if I could have gone around topless, it probably would have healed a lot better, but I have boys that I live with, so that wasn't really the ideal situation.
All boys?
All boys.
Yeah.
So I kind of had to put some clothes on, and it just didn't help.
Yeah, I totally get that.
But it was bad. I feel like most people, radiation is the easy part, and that was the challenge for me.
Okay, so you were, let me do the math on this. You were 38?
I was 39.
39 when you were diagnosed?
Yep.
Okay, and it was stage 2?
Yes.
Was there any lymph node involvement?
Yes. I actually had an appointment with my radiation oncologist today, and I said, how many lymph nodes were there? Everything said multiple. She pulled up my imaging and tried to count, and she said there was maybe like 7.
Okay. So with the damage that you had from radiation and the healing and all of that, that's what really changed the trajectory of the surgery.
Yeah. I mean, I could potentially have implants, but Dr. Aria wants to use as much of my own tissue as possible just to help heal the best possible way.
Yeah.
Does she share with you why she doesn't want to use implants?
I think just because if my tissues is damaged as it is, I don't know if it's going to perfuse as well. If you put an implant in there, it just may not hold properly. Yeah.
Yeah. Okay, so I don't know what this is, and I know that you looked it up beforehand. So can you tell us what DIEP stands for?
Yes. So I had to look up because I always forget what the I is. So it's a deep inferior epigastric perforator. And so what they're doing, a lot of people will say, oh, you're getting a tummy tuck. And it's kind of what it is. They are taking the skin and the fat, but there's also vessels in there. And what they'll do is make breast mounds out of that tissue and try to reconnect the vasculature into the mammary vessels. So she told me I would never be able to have a cabbage in the future, which hopefully I never need one, but that it will be kind of constructed into those vessels somehow.
Wait, what's a cabbage?
It's a coronary artery bypass.
Oh,
Yeah.
Okay. Because I was like, I don't like cabbage anyhow, so I wouldn't want to eat that.
I went straight to breastfeeding. Like, what does the cabbage leaf have to do with this one?
Nope, the actual procedure.
Got it.
Yeah.
Have they told you how many hours that it's going to take?
It's going to be between 8 and 10 hours. I'm expecting the best sleep of my life.
Alicia, what is your family going to do while you're in there?
Well, both my kids will be home and my husband will be home with them while I'm in the hospital, because I'll be in the hospital for at least 5 nights. My youngest is going to 5th grade camp, so he won't get to experience any of this. But I should be able to have visitors inclusive of my husband and my son.
Will someone be there with you?
My husband's going to drop me off, but I think he's one of those people that if he can't do anything directly, he's just like, well, I can't do anything to help out, so I'm just going to go about my day.
Oh, no. I sent mine home when I was in labor.
Oh, my
I was like,
gosh.
just go home. Go sleep at home. I don't need you.
Yeah, that's how he is.
Okay, so what's your preference, though?
For what
Like, would you want somebody there with you? Would you
not really, because he's going to come as soon as we're done. he'll hopefully be able to come in and see me. I think the visiting hours may be over, but hopefully they'll at least come in, let him come and say hi. But if I'm sleeping in a surgery, it's not like he's going to be able to do much.
Yeah.
So
yeah,
I'm okay with that.
I understand. I didn't have a choice because of COVID, but I remember that I really wanted somebody in there with me when I was taken.
Yeah. I think he'll probably stay with me as long as he can, and then he'll leave. Because for the mastectomy, he wasn't allowed to really come in and do anything. So,
yeah. So you know exactly.
Yeah.
When you get out of surgery, have they explained in any level of detail what you should expect?
And not really in detail. I mean, I have an expectation because I've had 2 C-sections, so I know kind of how it feels to have my abdomen cut open. I've had the mastectomy, so I kind of have an idea of what to expect with my chest being operated on. So it's going to be an all-in-one thing. I am not somebody who likes to ask for help very much, so I do know that I'll need to ask for help, though, to get up and use the bathroom or whatever they need me to do. I'm going to be in the ICU the first night, so I've never had that experience before. I don't really know what to expect.
Yeah, I wonder if they're going to try to wake you up or try to keep you out, or what are they going to do?
I think I'll probably wake up like they normally would out of a surgery, but I don't know. I know they have a lot of monitoring they have to do because they are going to be monitoring blood flow. She said there would be Dopplers to make sure the blood is perfusing to the chest, but I don't know what really that looks like.
Maybe they won't let you sleep at all.
I know. I probably won't because I'm going to sleep for 10 hours.
Well, I'm hoping they wake you up and they give you good pain meds and you get to go back to sleep and they put everything all your bodily functions on autopilot.
Yeah.
And then that way, once they move you to your room, it's a little bit better.
Yeah.
You sent me a note. I was asking how you were doing. And you sent me a note saying that you had gone to your pre-op last week and that you came out like kind of head spinning, even though you were kind of prepared for it. What did they tell you to expect from your pre-op? I mean, they're giving you all your meds and you're getting, all that stuff.
I think the part that's kind of sent me for a loop was when we first talked about the surgery and getting it planned, she was pretty confident that I would have a successful DIEP+flap. Then when I saw her this last time for the pre-op, she did mention in the first visit that the left side, for whatever reason, I think the way the anatomy is with the vessels is a little bit trickier. So she was glad that it was my right side that was the radiated side because hopefully it will make it easier. But when we met this last time for the pre-op visit, she sounded a little bit less confident that the left side was going to be successful. So I kind of felt like I'm going to wake up and have a surprise and not know fully what I had. It's possible that maybe she does put an implant in and take the expander out on the left side because her focus is on the right side because she knows how uncomfortable I am. But I was kind of leaving there feeling like, oh, well, I thought this was all kind of figured out. And now I don't feel totally confident about that.
Yeah, I'd feel a little nervous.
Yeah.
Do you trust that she's going to do what's best for you?
I do. She really knows what I want. I feel like I've made it pretty clear over and over. So
Yeah, and you've been with her for like years now, right?
Yes.
Yeah.
Yeah. So I think she'll make the right decision. I just don't like not knowing what that decision might be.
The only thing I can compare that to, and it's not really a comparison, is knowing how many drains I was
That's exactly what I thought of because I remember you talking about that. And that's where I kind of was like, well, I guess I'll find out when I wake up.
Yeah. And it sounds like she's really going to do what needs to be done. I mean, I know a lot of times they don't know what they're looking at till they get in there.
When you get done with this hospital stay and they're saying 1 day in the ICU and 5 more days or whatever it is, are they saying at least 5 or like on day 5, we're throwing you out and you have to go home?
It depends on...
Is it also depending on how you're doing?
Yeah, it'll depend on how everything's doing. She did mention that I could potentially be there till Friday. And in that case, I may be able to get my drains out before I go home, which would be really nice. But I'm also not in a hurry to do that if it's not ready to be done.
Yeah.
Right.
Yeah,
and
completely.
Then what's your plan for once you go back home?
I subscribe to Paramount. I have a lot of books.
I subscribe to Paramount Plus.
Subscribe to Paramount
Plus.
But this is the plan.
This is the plan.
I love you.
And then when I'm feeling a little better, I'll probably start working on some stuff again.
Okay, so if I was a patient and you were a nurse and I asked you that question, how would you answer
Just
it?
like that. I do plan to get active again, but I also know I have to be smart about it because I don't want to set myself back. So I have to find things to do to keep myself entertained while I have to sit around.
Yes.
While you have pterodactyl hands.
If I could give you any advice I've spent most of my professional career in patient data. And the thing that people are the most unhappy about is that they were unprepared for recovery.
Mm-hmm.
So maybe go back and listen to Kristen's episode about how she got ready to recover, because she's like the pro, and she even made worksheets and checklists that I think you can download them from.
I might have to look those up. I have a lot of the stuff from the mastectomy. Again, I remember sleeping was really challenging because I had to sleep on my back. I had to sleep upright. So I imagine more of that. We have a taller bed, which is helpful for getting in and out.
I can teach you how to build the best pillow throne.
Yeah, that's what I need.
I really built a recliner in the bed. In fact, even I shared a hotel room at a podcast convention after my exchange surgery. And I was like, this is my pillow throne.
It was impressive. Impressive.
You can market that.
I totally could. Do you guys have a recliner at home?
No.
Because that's one thing
I know you can rent them. You might actually be able to just rent one for a few weeks.
I was kind of looking into that a little bit, but I didn't look that hard. So I should probably look again because it's coming up fast.
We're worrying about you right now. Do you have a man-child for a husband, or is he pretty helpful? Oh, okay.
He can be helpful. He will probably work while I'm in the hospital, but then he can take time off afterwards when I'm home, so that he can help me with the things that need to be done. It's like little things like opening pill bottles. I'm like, I can't open this. So he will be around to help me with all that.
And to Kristen's credit, she had to do everything by herself. So she had to come up with all these systems because there wasn't anyone I can just yell, can you get me a...
Yeah.
And he just gets whatever I tell him to get me. But Kristen couldn't do that. So.
Yeah, that's a good point.
Yeah.
I'll have to pick her brain.
Yeah. Well, I'll set you up, girl.
Okay.
If I have to come to your house the day before and be sure it's all okay, I'll do it.
Okay. Sounds good.
I don't do that for everybody. Only because you're local.
Oh, thanks.
Okay. So I am so honored that you have been so vulnerable and open about all of this that's going on. You have a smile on your face, and I know that it's also very scary. But my question for you is, what are you doing to be able to keep smiling and not be fearful all the time?
I think I just am hopeful that the outcome is going to be better than what I'm going through right now. So as much as I'm not looking forward to a big surgery like this, I just feel like it just needs to get done at this point because I want to feel better.
It's that wanting those damn expanders out is very motivating.
Oh my gosh, the expanders are awful.
They are. I mean, they're not supposed to be in there that long. That's the thing. Like, they're not comfortable. I am looking forward to a year from now for you.
Yeah, I'm ready.
I'm looking forward to like a month from now for you. So your surgery is on the 13th, right?
Yes.
On May the 13th on a Saturday.
Yep, the day before my birthday, which is also Mother's Day this year.
Oh, wow.
Happy Mother's Day.
You should be getting some really good gifts. Yeah. Thank you again for being willing to be open. And it's nice that you have also like some nursing background to be able to understand all that's going on too, and explain it in a way was easy to understand. Because I was completely blown away by what a deep surgery was. So
I'm happy to share and explain anything that I can.
Well, I look forward to talking to you in about another week and a half. And let me know if you need anything in the meantime. Okay. And we will have a little session about getting you prepped.
All right. Sounds good.
Thanks, Alicia.
I'll turn the Paramount Plus off for that one. Thank you.
Thank you for listening to Breast Cancer Stories. To continue telling this story and helping others, we need your help. All podcasts require resources, and we have a team of people who produce it. There's costs involved, and it takes time.
If you believe in what we're doing and have the means to support the show, you can make a one-time donation, or you can set up a recurring donation in any amount through the PayPal link on our website at breastcancerstoriespodcast.com/donate.
To get the key takeaways from each episode, links to anything we've talked about, and promo codes or giveaways from our partners, sign up for our email newsletter.
You'll get notes and thoughts from me related to each episode and links to the most useful resources for all the breast cancer things. So if you have chemo brain, you'll be able to just go read your email or find anything we talked about on the podcast without having to remember it.
The link to sign up is in your show notes and on the newsletter page at breastcancerstoriespodcast.com.
We promise not to annoy you with too many emails.
Thanks for listening to Breast Cancer Stories. If you're facing a breast cancer diagnosis and you want to tell your story on the podcast, send an email to hello@theaxis.io. I'm Eva Shea, your host and executive producer. Production support for the show comes from Mary Ellen Clarkson, and our engineer is Daniel Cruiser. Breast Cancer Stories is a production of The Axis, THEAXIS.io.